We need to talk about Mary Cooper because she was on the brink of death, struggling to breathe when doctors dramatically swooped in at the last minute to save her life. But the big thing is that they did so completely against her wishes, right? She signed a do not resuscitate order, and by ignoring it, doctors put her and her family in a painful situation that they hope to avoid. And unfortunately, her story isn't some crazy one-off. Instead, it's just one of many that highlights an ongoing crisis in the medical community with confusion around DNRs that leaves doctors unclear on what's required of them and patients uncertain that their wishes are going to be respected. Because again, Cooper is just one of the many people who have tried to make their wishes on resuscitation clear. With her daughter, Sherry Uphold, telling the New York Times, "My mother's religious belief is when it is her time to go, that's God's choosing, not hers. She was very adamant about that." And so as a result, Cooper had a do not resuscitate and do not intubate order on file for decades. And then when doctors found cancer cells in her stomach last winter, she filled out new copies explicitly stating that she did not want medical staff to take measures to restart her heart if it stopped or to give her a breathing tube. And at least on the surface level, DNRs are very straightforward, where they basically say that if a person's heart stops, and in some states if their breathing stops, medical staff shouldn't perform CPR, give medications to restart the heart, or take other resuscitative steps like intubation, ventilation, or defibrillation. But that proved to be much more complicated for Cooper when she went to the hospital in February for a stomach scope to determine how serious her cancer was. Because when Uphold went to visit her mother in the recovery room, she found her panicking, gesturing that she was unable to breathe. So Uphold called for help and was escorted into a waiting room while a medical team called an emergency code, with a medical record showing that Cooper became more distressed and uncooperative, so the medical team restrained her and inserted a breathing tube down her throat, thus saving her life while violating the explicit wishes stated in her medical chart. So Uphold, she was pissed, but when she confronted the doctors, they couldn't explain why her mother was intubated when she had made it very clear that she never wanted to be given a breathing tube. And then, when Cooper woke up, she started trying to pull at the tubes and IV lines in her body, with her motioning to her daughter and the doctors that she wanted the breathing tube removed, and Cooper herself later telling the Times, "They had me tied down. I was scared to death," with Uphold finding herself in the exact situation that she and her mother wanted to avoid, but her hands were tied, or as she told Cooper at the time, "If you take that out, you're committing suicide, and if I take it out, I'm murdering you. I won't do that." The breathing tube was then left in, and Cooper became very sick, developing pneumonia and going into septic shock. By the time that she was actually finally stable enough to have the tube removed and go home on hospice care, the sickness and intubation had left her incredibly weak, limiting her mobility. So now she deals with horrible anxiety, waking up most nights grabbing for imaginary tubes. And this is she also now needs in-house care 24/7 and is unable to bathe, dress, or cook for herself. And because her family can't afford full-time caregivers, they end up providing most of her care. And this is Cooper remains angry at the doctors who saved her life for putting her and her loved ones in this position, telling the Times, "They interfered with me and God. I was ready to go, and they took that away from me." Right, and that is exactly the sentiment that many people have when they sign DNRs. Right, the majority of patients who sign these orders are older people, and usually folks who have serious underlying medical conditions. In fact, people older than 85 are as much as 4 times more likely to have a DNR than adults under 65. But also, plenty of young, healthy people have them as well, with studies showing that between 10 and 20% of all hospitalized adults have DNRs. But again, many patients that need resuscitation are people who are already sick or frail, meaning that attempts to save them might not work. Or like we saw in Cooper's case, successful attempts can result in significantly lowered quality of life. I mean, take something as common as CPR, for example. Even when it's successful, it can cause irreversible damage because chest compressions can break the sternum and ribs or puncture the lungs. And that can prolong pain and recovery in anyone, but for people who are already sick or frail, those injuries can become insurmountable or stay with them in some form for the rest of their lives. And also, despite what we've all been led to believe from medical dramas, CPR often doesn't actually extend life in a meaningful way for many people, especially older folks. In fact, a 2021 review of global studies found that only between 11 and 28% of older patients who experience resuscitation after cardiac arrest in the hospital actually survive long enough to be discharged. And that number actually dropping to just 11% outside of a hospital setting. And then even when people do survive, they often have brain damage that can further lower their quality of life. I mean, that's exactly what happened in the case of Cliff Robson, for example, who had known for decades that he did not want to be resuscitated. But when his vital signs worsened while in the hospital preparing for a heart valve replacement, the medical team performed CPR and restarted his heart, seemingly not knowing that he had a DNR. And in this process of stabilizing his heart, Robson sustained multiple broken ribs and remained unconscious afterward, with a brain scan then showing minimal activity, forcing his son to decide whether or not his father should receive a feeding tube to keep him alive. And again, Robson is not alone here. So it brings us to the million-dollar question. Why the hell does this happen to people who clearly spell out their wishes? And well, as it turns out, it actually comes down to issues with the definition of resuscitation, or more accurately, the lack thereof. Right? Because back in the 1960s, resuscitation primarily referred to CPR. But even then, according to Dr. Max Virgo, a palliative care doctor for Dartmouth Health, medical professionals considered that to be the nuclear option to bring bring someone back after their heart stopped. But then we saw the interpretation of the term shift drastically by the 90s, within medical literature using resuscitation as a sweeping catch-all to include tons of other medical interventions that would be used in cases that don't necessarily involve cardiac arrest, things like administering IV fluids or giving high doses of steroids for infections. With Virgo also explaining that while DNRs themselves as legal documents didn't change in scope, the liberal use of the term resuscitation created confusion, right? And that resulted in doctors administering or withholding care differently to patients with DNRs based on their own different interpretations. And in many cases, like with Cooper and Robson, that means administering resuscitation measures a patient didn't want. But also a thing is it goes the other way sometimes too, right? Sometimes doctors will withhold care permitted under DNRs like transfusions, antibiotics, or dialysis because they're confused about whether that kind of care can be given. With a 2017 survey of 553 medical residents in the US showing that a substantial portion would have made the incorrect choice to withhold necessary medical care for a DNR patient. Hell, some even believe that diagnostic tests shouldn't be ordered for DNR patients, even if that's absolutely permitted. Also, another part of this equation is that medical professionals are more likely to perform CPR if a patient goes into cardiac arrest due to a complication with treatment rather than because of underlying conditions. Or with that same survey finding that nearly 7 in 10 medical residents said they would override a DNR in case of physician error, with some physicians arguing that patients don't anticipate cardiac arrest from a course of treatment when they agree to a DNR. In fact, many doctors actually suspend DNRs for surgery so they can correct reversible problems that might crop up. And while some hospitals do have policies in place that allow doctors to address those kinds of issues without suspending a DNR, the language and interpretations of those exceptions aren't consistent, with one expert here arguing that patients should have a right to decide if they want their DNR to remain active during surgery, but also saying at the same time that doctors should have a right to say if they're not comfortable with that. Noting that, in addition to personal reservations about not wanting to operate on someone who could die a preventable death, surgical mortality rates are tracked by national databanks and can reflect poorly on both the hospital and surgeon. But oftentimes, the thing is, those conversations just don't happen. And it's the same for discussions about DNRs in general, even outside of the operating room, which can further lead to misunderstandings about what a patient wants. And then even beyond all that, there are plenty of other simpler reasons why DNRs are ignored. Doctors might just not know they exist, hard copies are easily misplaced, and information is lost during transitions of care. But regardless, right, the situation is people have DNRs violated and their families can have little legal recourse because most violations are hard to litigate, which then can also make it challenging to find a lawyer who will even consider taking the case. Now that said, numerous medical institutions are taking steps to clarify the language of do not resuscitate, with some hospitals even using the phrase do not attempt resuscitation to highlight the fact that CPR often doesn't actually revive people. Some doctors have also said that they like more explicit phrases like no CPR or terms that frame the choice as positive rather than a desire to withhold care like allow natural death. And there, it'll be interesting to see if that shift catches on at a broader scale and whether it's actually going to make a difference. But in the meantime, I'd really love to know your thoughts here, whether you've had someone that had a DNR, you have a DNR, you're someone in the medical community. Any and all thoughts and reactions to this, I'd love to hear from you in those comments down below.